So dental implants, you say, are very popular now. What are the options for denture wearers?
Well, actually, it's pretty exciting because you have a lot of options as denture wearers. Okay, you can do something as simple as we can actually use your own denture. Okay, we put 2 implants in the front tooth here. Okay, and then we can put a little snap on them, so you can actually use your own denture, snap it out, put it back in. A lot of stability.
No more adhesive?
Don't need any adhesive. Nope, not at all. Okay.
Okay.
Or what you could do is you could get a new denture with that if yours so, but you don't have to do that. The snaps can work. Now, if you want to get a little more stability, you're talking about then maybe putting 4 in, like in here, and then you can have four snaps, and it's a lot more stable. Okay. You can do 6 and do the whole arch. Okay. Now, that's particularly helpful on the lower because lower historically are very difficult to stay, the stability stuff, but on the top, that means you don't have to have a big palate in there, so your food tastes better. Okay, your tongue feels more natural.
How old can you be to get dental implants?
How old can you be? You have to be older than about 25. Okay, and actually we have some
could
people,
you be 80 years old and get dental implants?
You could be 100 years old.
Interesting.
I would say probably the last person I referred for implants, I referred her to a periodontist because it was a particular case. She was 81.
Interesting.
But she was feisty 81, and she really enjoyed it.
Okay, so with these, now it seems very painful. You say it's not so painful.
No, I'll tell you what, my first case I worked with another doctor on it, and it was my mother-in-law. It's a little gutsy. And I asked her afterwards, I sat through the procedure, and it went fine, and I asked her afterwards, I said, how was the discomfort? And she looked at me and she said, well, I was a little warm. And I said, oh, the point is, the bone, which is where it seems like everything's happening, doesn't have the nerves in them. The nerves are in the tissue on top of the gums. So it's almost, you get an injection like you're getting Novocaine. It's just regular Novocaine.
So it doesn't hurt?
It doesn't hurt a bit. No, I've never heard anyone. I've always asked people, how was it? Well, the first 50 people I asked, because after that I didn't bother asking anymore because no one ever says it hurts.
So no more dentures? No more traditional dentures?
No need for denture. Nope, it's not needed anymore. And it's unfortunate. People don't know that. And I'd love people to start talking about it and say, hey, look, you have an option. You don't have to use the Fixodent and swallowing. It's a mess. Okay? And so you're actually, if I was to design a human being, I would have designed a human being with a 3rd set of teeth. This is your 3rd set of teeth.